Good morning, everyone. I am Dr. Ishani, PG resident at Hamdard Institute of Medical Sciences and Research. My motivation starts from a daily scenario that we see in the hospital of taking out the blood samples in an ICU settings or accidental areas where it is very difficult to take out blood samples from patients. So daily pricking is very cumbersome for the patient also, and there is no such technique that we have established as of yet where we can see a non-invasive technique for accurate blood estimation. So there was a finding that I had seen in OPD. This was a blood cell that was flowing through blood vessel in a conjunctival blood vessel. There are several videos that are supporting this factor. So this is not merely an incidental finding, but rather we can see we have supporting papers for non-invasive techniques, the transdermal optical imaging, the functional near infrared spectroscopy, or the photoplethysmography, the Fitbit or smartwatches that we see. However, these are not as accurate as the invasive technique, and nothing can supersede the invasive techniques. So there was a supporting paper that was given by Joe H.C. et al. In 2021, where he said that the range of conjunctival blood flow velocity is 0.078 to 0.0338 millimeter per second in a healthy adult, and he calculated the average bulbar conjunctival vessel diameter to be around 10 microns. So the principle behind my innovative idea is, in a given area of blood column, by assessing the velocity of cells, we can evaluate the flow per unit time area. Flow per unit time area will be equal to the velocity into area of cross section. According to Joe H.C. et al., it will be around 78.5 into 10 to the power minus 12 meter squares, and this result will be compared to the invasive technique and calibrated accordingly, which will give us the increasing or the decreasing trend. So my study design will be healthy adults 20 to 50 years of age with nil systemic illness. It will be an experimental study and will require ultrasound Doppler probe, which is tunable to 20 to 50 megahertz, a portable ultrasound machine, and a fast Fourier transform. So we'll use the same procedure for A-scan that we are using. However, instead of using the cornea, we'll be touching the conjunctival blood vessel. And instead of 8 to 10 megahertz that we are using in A-scan, we'll be using 20 to 50 megahertz. This will be a novel technique and a feasible one. We are in the conceptualization phase. We haven't experimented yet. I'll require the know-how and the expert opinion of our faculty for the same for this. Thank you.
Very innovative idea, but there'll be a lot of difference because the child, especially the child, the eye conditions are not all the same. You know, you intend to open the eye, the patient tries to close the eye, then there will be a little bit of congestion. There will be change of flow of the blood in different positions in different times of the day. You know, it'll vary quite a bit.
Next, thank you so much. Please collect your certificate.